She's a clinical speaker for Invisalign, and she's a member of the European Board, the European Advisory Board of Alignment Technology. So please welcome Barbara Reinstenhofer. Thanks.
Thank you very much. It's great that this first aligner meeting is taking place in Vienna, and it's a great honor for me that I was introduced by my professor, by my great teacher Hans-Peter Bandleon, and it was because of him I had the possibility to see such a variety of treatment techniques at the university, which can I implement now in my treatment with Invisalign. And he said once the sentence, "The osteoclasts don't look up and care who is pulling up there." So I decided to do my treatment with Invisalign. Today I will lecture about open bite. And as you know, we have a dental, frontal or lateral open bite and a skeletal open bite. This is important for your treatment consideration, because if you take a look to the pictures, it's much more difficult to treat the skeletal open bites than the dental open bites. You can treat open bites by extrusion or of frontal teeth, intrusion of molars, or a combination of both, which I do mostly, or by with surgery. And as I told you before, I have seen a lot of great techniques at the university, and also the Sato technique. And I was taught by Professor Sato personally to bend this wire, and I was very fond of that technique. And I did a lot of wire bending, and it was a lot of hard work, and I told my patients then, when we finish the treatment, you have to wear them as jewelry, because they look so nice. So, but now I have a riddle for you. That's a famous open bite. You know who is that? Very good. She's not maybe an orthodontist from Washington, D.C. This is one of my first open bite cases. At that time, it was only possible to treat the open bite with Invisalign by extrusion of frontal teeth. And you can see, the clean check. Today it does not work. Yesterday it works. Maybe you're going to check. You can see the amount of extrusion. This grid is shown 1 millimeter in square, about approximately 2 millimeters of extrusion. And nowadays, this is done with the new CleanCheck Pro. You just click on the button. You see here, very up here. You click on the tooth. Here is the extrusion button. Here you move it with the cursor up, downwards, and here you can see the amount of extrusion you have performed. And this is the final outcome. It worked very nicely without great efforts. And I could change the smile line. That's a similar case. It's also a dental open bite. So I decided to treat it with extrusion of the upper frontal teeth and establish a nice proper torque in the lower frontal teeth to get rid of the danger of the gingival recessions. And as you can see, the smile line improved a lot just by extruding of upper frontal teeth. That's a similar case. It's also a dental open bite, but it's much more tricky because here you have to protrude the upper frontal teeth, and then it's more difficult to close the open bite. It's always easy if you can retrude the frontal teeth. And here you can see the CleanCheck. You can see the power ridges on the frontal teeth just to establish a nicer torque. And also the smile improved. This one is a skeletal open bite, and it was planned to be done surgical. But as you know, all of you know, as clinicians, sometimes the patient gets scared and they say, no, I prefer to do it without surgery. So I tried to do it without surgery. Here you can see the ClinCheck. We had to expand, put a big expansion in the upper jaw, correct the cross bite, and then close the open bite. Here you can see the before and after, and it worked nicely. I could nicely close the bite, and the teeth look nice, but here you can see the superimposition. I also had done a little bit of intrusion, but I'm not happy with the gummy smile, and I think she should go to surgery. This is another case, an open bite case with protruded upper and lower frontal teeth. You can see here, I decided to treat it with the extraction of 2 upper bicuspids. And again, this is easy in a case like that to close the open bite, because you can retract the canines and then bring back the frontal teeth, and automatically the bite closes. Here is the ClinCheck from the frontal view. And here is the before and after situation. Before and after. The superimposition, you can see how we could manage the huge overbite and overjet. And there's a big improvement of the smile line. And that's the good thing, you can always do your treatment planning, your treatment on the computer, and you have always the face of the patients beneath you. That's a patient, she showed up in my office. She came from somewhere else with a relapse, and it looked really difficult to treat. I was afraid if I could close the bite. And that's the ClinCheck. You can see I did a lot of extrusion, but also a little bit of intrusion in the posterior area. Here you can see the ClinCheck from the side. And here she's still in treatment, but with the last aligners. I could close the open bite and also change the angulation of the teeth. That's also an open bite with a severe crowding and a severe overjet. And this patient is still in treatment, but I like to show it to you, because that you can see how easy it's to do the extrusion with the Invisalign technique. Please take a look to the lower canines, how nicely they are walking up. It's always good in the ClinCheck, it's always like a video game, but it should also happen in the mouth. The ClinCheck from the side. Please again look at the lower canine, and also in the distalization in the upper molars, because you have to implement it. If you want to close the bite, distalize and be careful not to extrude. That's the progress. Please again take a look to the lower canine. It's moving, extruding very nicely. And that's from the frontal view, and that's from the buccal view. We are here at this position now in the moment. I could totally correct the severe overjet. And maybe she's going to be a deep bite case. This is a case with a frontal and lateral open bite, with a tongue interposition. If you take a look here, in this place. The ClinCheck from the frontal view, if you take a look, I extruded the upper front and intruded the lower front, just to change also the smile line. And then that's the buccal view. I needed to create space for this 2-6 tooth, just to give him the possibility to erupt. And as you can see, it worked nicely, but I also added some elastic bands with a button, and he's still wearing that on the tooth. as you can see, I also could change the smile line because I intruded the lower frontal teeth. So now I'm coming to the second part, the molar intrusion. It's told to be a difficult movement with fixed appliance. Sometimes you need bone anchorage. With Invisalign, you can see it needed 14 aligners to intrude the molar, and you can see it here, how it worked. And it was surprisingly easy, just 15 aligners. And here again, you can see how you do it nowadays with the CleanCheck Pro. You again click on this button, then you move the cursor, and then you can see here the amount of intrusion you will perform, you hope to perform. And here I always try to request, if I expand, please intrude the lingual cusps, so you can easily close the bite. That was my first patient Invisalign I treated with the intrusion of molars. And that was be told by Invisalign. The intrusion of molars is a challenging movement, it will not happen. So, but if you don't ask, you won't get. I insisted. And here you can see I tried a little bit, slowly, distalization and intrusion, and it worked. From that on, I implement it now in most of my open bite treatment. This is a case, please take a look to the gummy smile again. I've learned from the last case. It's only a little bit of open bite case, so you could close this open bite easily by retruding the upper front. But I wanted to change also this horrible gummy smile. You can see we have to distalize, to expand, to correct the crossbite, and to very little bit of extrusion of the upper frontal teeth. She's still in treatment, and you can see here, it's a kind of a little bit the idea of the Sato technique, if you take a look how the buccal distal molars are moving. And the teeth look nice, but I could really change the gummy smile. That's another case with a high angle case, skeletal open bite. Here I made a combination of intrusion of molars and extrusion of frontal teeth. CleanCheck from the side. Again, also a little bit of distalization in the lower jaw, so you have to be really careful that you don't extrude them anymore, because it would worsen your open bite. And here, again, I started with the intrusion of the palatal cusps. And that's the before and after situation, before and after. Here is now my biggest open bite I've ever treated without surgery. I try. She's still in treatment, but I want to share it with you. Look at that. And that's the CleanCheck. If you take a look, we have now until aligner 20. Then the frontal teeth start moving. I only started with the intrusion of the molar, and you have to add it tooth by tooth intrusion. That's from the buccal view. Only in the beginning, only intrusion, no extrusion in the beginning. At aligner 25, we start with the extrusion of the frontal teeth. And here you can see, I have to show it here, this is at aligner 24. And it's showing this situation. If you check the next one, this is at aligner 24, what the CleanCheck is showing, because the CleanCheck does not show articular-mounted models. So if you intrude the molars, the ClinCheck will not show you the actual bite closing. So you have to imagine it. And you can see the difference. It moved so fast. And now, from now on, it will work with the normal velocity. But the patient got impatient because she told me, "Doctor, it worked so fast." And now I gave her this Autopulse appliance. And she's changing her aligners now once a week instead of every second week. And there is a study also from one of the colleagues of the Vienna University about this kind of light. And the good thing is you can control your patients. You have an app, and you can check if this patient is wearing his lamp, using his lamp every day 10 minutes. That's what she's looking now. That's another case. Open bite. This patient has only contact on the molars. And she has had severe digestion problems. I also started with the intrusion of the molars, and distalization and correction of crossbite. And here you can see the progress from the buccal view, distalization and closing of the bite, the before and after situation. It did not take any refinement. It worked from the first part on. A similar case, but more tricky. You can see only contact on the molar area. You can check it now with the new ClinCheck Pro. That's the ClinCheck. Again, I started with distalization and intrusion. The ClinCheck, again, you can see distalization, but always be careful not to extrude if you distalize. It also worked nicely, but I have to close this with elastics in the buccal area, before and after. This is a case, it's really severe, difficult to treat because the patient refused surgery or extraction. So just aligning of the teeth, open bite, skeletal open bite, cross bite, crowding. And again, I had a big intrusion in the molar area and also extrusion in the frontal teeth. Upper and lower front about 3 millimeter. And here, if you measure it again with the grid, which is representing 1 millimeter, I've intruded about 5 millimeters in the molar area. And she is still in treatment, but bite is nearly closed. This patient was also planned surgical because she had a severe open bite and a class 2. And again, it happened to me. The patient said, "Oh, it's looking so nice. I think it's okay. I just put veneers on my frontal teeth as it was planned and leave it like that. But I still want to treat it to correct the class 2. You can see again, intrusion of the molar and extrusion of the frontal teeth to correct this maxilla. This was the surgical bite jump, which was planned. And this is the patient now. She would be ready to go to the surgery, but she refuses because she says, "I'm looking really nice now." This is my last patient I will share with you. Also skeletal and dental open bite. This was the before situation. And again, he came with his mother. I was not allowed to even talk about surgery or anything else. Again, intrusion in the backward area, and then extrusion in the frontal area. From the side, distalization upper jaw to reduce this overjet, and again in the end, the extrusion of the frontal teeth. That is the progress. From the buccal side, we also could correct the class 2. The other side, before and after, and the before and after. And here is the superimposition. You can see we've intruded the lower molars and extruded the frontal teeth. And that's the smile line, before and after. Thank you very much for your attention.